Medicaid in North Carolina is moving from Medicaid Direct, the current system, to managed care. This transition is confusing because not everyone with Medicaid has to choose a health plan. But the majority of people with Medicaid will have to choose a plan, also called PHPs, or they will be auto-assigned. However, some people with Medicaid aren't allowed to choose a health plan, and others have a choice to choose a plan or stay in Medicaid Direct. Do I need to choose a health plan? It depends. See if you can answer yes to any of the following statements. I have Cap C or Cap DA. I have a Medicaid spend down. I am enrolled in PACE, Program of All-Inclusive Care for the Elderly, or HIP, Health Insurance Premium Payment. I have Medicare. I have Medicaid as a refugee. If any of those statements applied to you, then you are not allowed to choose a health plan and don't need to do anything to keep the services you already have. If you have the Innovations Waiver or TBI Waiver or receive services through an LME, MCO, you can choose to be in managed care by choosing a health plan. But if you do this, you will lose your services through the MCO. If you get a letter telling you that you need to choose a health plan, but receive services through the MCO, you need to take action to request to stay in Medicaid Direct. Call the Enrollment Call Center or fill out the form linked in the video's description and choose the option for Enrollee and Beneficiary. If you have a serious mental illness or IDD, but are not receiving services through an LME MCO, you do not have to choose a plan, but you can if you want. If you need certain services to address needs related to developmental disability, behavioral health, traumatic brain injury or substance use disorder, you may want to remain in Medicaid Direct. If you qualify for the Eastern Band of Cherokee Indians tribal option, you have the option to choose a health plan if you are a federally recognized tribal member or qualify for Indian Health Services (IHS) and live in Cherokee, Haywood, Graham, Jackson or Swain County, or if you live in a neighboring county of the 5-county region. You may choose to enroll in the Eastern Band of Cherokee Indians (EBCI) tribal option. As a member of the EBCI tribal option, you can still get services from any Medicaid or NC Health Choice provider. If you have waiver services, you can choose the EBCI tribal option and still receive those services. If you have Medicaid but none of these scenarios apply to you, you will likely need to choose a health plan. If you don't, you will be auto-assigned. If you want to continue seeing the providers you have, find out which plan they are choosing so you can be sure to remain in network. Important things to remember. If in doubt, call the Enrollment Call Center at 833-870-5500. If you don't know where you should be, the Enrollment Call Center can look you up by your Medicaid number and tell you whether or not you need to choose a plan. They can also help if you think you are in the wrong place, or you can fill out the form linked in the video's description and choose the option for Enrollee and Beneficiary. If you have questions or a problem, always start by calling the Enrollment Call Center at 833-870-5500. If they are unable to help you, call the Ombudsman at 877-201-3750. Finally, if you are given a choice to move to managed care or stay where you are, you can always opt out of choosing a plan. There is no harm in choosing to stay where you are. However, if you received a notice and do not choose a plan, you will be auto-assigned. The deadline to select a plan is May 14th. But you will be able to change your plan until the end of September. You can find all the phone numbers and links mentioned in this video in the description below. Visit disabilityrightsnc.org for more information on Medicaid health plans.